So Mr. Freeze works as an ice cream man who drives his own ice cream truck 5 to 6 days a week. He works with his wife, Elsa. Elsa dropped a scoop of ice cream on the floor, and during a busy shift, Mr. Freeze took a fall. During his fall, he slipped and fell with his arm outstretched, causing the acromioclavicular joint degree 1 injury of his right dominant side, which was then diagnosed at the urgent care. They told him to go see an orthopedist, but stubborn as he is, he figured he would just power through it on his own. So he went to Walgreens and purchased an over-the-counter cloth immobilizer, which he kept on for 6 months to help with the pain. When he finally tried to take his arm out of the sling, he could not move it, so then he finally visited an orthopedist who diagnosed him with frozen shoulder.
Some functional limitations due to this injury would include decreased range of motion, which includes decreased strength, tone, and endurance, as well as joint stiffness, and also driving his ice cream truck and scooping ice cream.
Analysis of those two activities, driving his truck and scooping his ice cream. In driving his truck, he must extend both of his arms to maneuver the steering wheel since it's far away and it's very large in diameter. His hands are about shoulder width apart when he's gripping the steering wheel, and there's a slight bend at the elbow around 30 degrees of flexion. The shoulder is at 70 degrees of flexion. There's a horizontal adduction and abduction of the shoulder, along with internal and external rotation of the shoulder as he turns the steering wheel. To scoop ice cream, he bends at the waist anteriorly to reach into the freezer. To scoop his ice cream, he has to reach down into the freezer by fully extending his arm to 0 degrees of shoulder flexion. Using strength and tone to be able to maneuver the ice cream into scoops, there is wrist flexion and extension, ulnar deviation, and wrist pronation and supination in order to scoop the ice cream into perfect scoops.
Mr. Freeze is a hardworking man who values his business that makes children happy, and due to his injury, his values could be interfered with. Occupational therapy may appeal to Mr. Freeze as it will not only be exercises, but working towards resuming his previous meaningful occupations. Grading the activity of scooping ice cream, but using lighter and longer scoops can help with getting Mr. Freeze to be able to engage in that activity again. If we can increase his occupational performance in driving and scooping ice cream, we can increase life satisfaction and engagement in meaningful occupations.